So this is Jay Walker, and I want to welcome Patrick Geraghty, the CEO of Florida Blue, to Talks at the Library of the History of Human Imagination. And in the spirit of innovation, we're doing this talk over a Google Hangout, though you'll see it's supplemented by all kinds of wonderful camera work. But Patrick, welcome to the library remotely today. It's a pleasure to have you.
Thank you, Jay. It's a pleasure to be with you, and we're really looking forward to this TEDMED experience.
Well, you know, TEDMED is all about innovation at a deep level. And when we say innovation, we really mean at the core innovation in how we think, how we behave, and how we approach and understand problems, not just in how we solve them. So, as the head of a very large organization, right from the start, you've made innovation sort of a key theme of what you see the future of Florida Blue, and in many ways the future of the whole insurance industry is. Could you talk to me about how you define innovation as the CEO and as an organization?
Yeah, we have incorporated in our company values the word imagination, which we look at as a broader scope issue because we want everyone to come to work, bring in their brain and thinking differently about issues that perhaps they've thought about over time and really haven't brought a new perspective to that. So the imagination issue is very important to us, and part of that is innovation, more specifically thinking about problems differently, reaching out and making sure we're talking to our members and customers and people who are impacted by us each and every day to bring their input into that creative process. So we talk about innovation every day, and we try and create frameworks for how people can think differently and access new information and unlock some things that are inside of them in terms of how they think about innovation and creativity.
Very few people talk about the difference between imagination and innovation, and I've got to say it's a fantastic thing you're doing. Let's just chat about it for 1 second, because most people think imagination is for kids and you know, sort of flights of fancy. And what I'm hearing you say in a manner of speaking is that innovation might be a small change or might be doing something a little bit better, but imagination is actually rethinking things. And we're facing a time in health and healthcare where clearly some rethinking is in order, not just some improvements that might be called innovation. Have I got that right?
No, I think you have that exactly right. And one of the other things that I think we've noticed over time is that people can attribute innovation to certain people in the organization. But imagination is something that everyone can have and that everyone feels like they can access. And so it can be small things, it can be big things, but we really wanted it to be a way of being and a way of thinking, and that's why we underscored it in our organization.
Tell me a little bit about how you're approaching the incubator side of your growth strategy.
So we have a number of different things in place, and I'll take you through a few of those. One is that a few years ago we started retail centers. And so when I was coming to Florida and I saw that we had retail centers in place and I looked at what we did in a retail center, I loved this idea. So we went from having 3 or 4 retail centers to today we have 11 around the state. So when our members come into our retail center, yes, they can buy product and they can look at their different options, but more importantly than that, they can have the full customer experience. You come in with an explanation of benefits, face to face, we'll resolve your claim for you. You want to sit down and talk to a nurse and have a health risk assessment done and have a health and wellness plan laid out, tailored to you, we'll take care of that as well. Our partnership also with Disney, we created at Epcot a health and wellness site for kids. It's fun, it engages them on hydration, on nutrition, and on activity. 3 simple messages, but they have a lot of fun going through the site. They learn about that, and then all of the intellectual property from our partnership with Disney is available, and available in our retail centers, available in our mobile device that we send around the state. So we've got a large van that travels to major events across the state, and kids can interact with that. On the other piece, we've got an entity called our Health Box, which we're doing with folks out of Lake Nona, which is just outside of Orlando. And in that Health Box activity, we're actually seeding new organizations that are upstarts in the health space so that we can invest in them help them get going, and then look at technologies that would be helpful to us or our partners in the marketplace. So we really are playing on all ends of this equation.
So, an insurance company in the retail business, that sounds as bizarre as a computer company suddenly opening retail stores. And we've seen what has happened, obviously, with Apple sparking the imagination. And we've also seen giants like Verizon and others, and AT&T, opening hundreds, if not thousands, of retail stores. It's ironic, if you look at it, that customers who are used to dealing in a retail environment have never been able to have a face-to-face relationship with an insurance company. And yet, it seems so logical. Is it affordable for an insurance company to be able to run a retail operation, or is it simply a sort of a public relations front end that looks very nice but really can't scale? And I'm not trying to be critical, I'm trying to understand.
No, I appreciate your comments here. And your analogy to Apple is one I've used a few times, right? So I've had reporters run at me as we've opened these stores and said, why would you be putting money into bricks and mortar? Everybody else is doing everything online. Well, Apple's created an experience with their customers, right? Our customers are dealing with a much more confusing product in a much more trying time, in something that's far more personal in their lives, and often very, very critical to how their family well-being is going to play out. We want to have that personal one-to-one interaction. So I would tell you, if we did it just as a sales vehicle, and that's how these retail centers started, that was not successful. What was successful is as we evolved it to be the full member customer experience. So when we put the claim interaction and helping people resolve that, when we put, believe it or not, we're dealing with technology right here, but lots of people want a warm transfer into technology. They don't intuitively get how to use the tool. So we'll take people through that as they're in our centers and help them learn how to use the online tool. They love being able to sit down with a nurse and actually have that interaction with a nurse. And in 2 of our centers, we've actually piloted having primary care physicians co-located in the center. So the center has evolved and will continue to evolve. When we open this, we ask the community around the center, what would you like this center to be? And help us construct where we go with this center. So I can tell you a couple of different things we've done. We are very invested in early childhood education and reading because literacy and health status are intimately linked. So in our centers, we'll bring in inner city kids, we'll give them books, we'll have an experience with one of the sports teams that we're associated with, the Miami Heat, the Orlando Magic, the Tampa Bay Lightning, the Jacksonville Jaguars. We'll read to kids. We'll bring their sports heroes in. Their parents, their teachers are involved. So we may have 200 or 300 people in a center experiencing an insurance company that they never would have experienced before. So this is really creating a relationship which in fact gives us the opportunity to change the health and well-being. We know we're touching hundreds of thousands of our members every year through our retail centers. So we're convinced, and we've looked at the data in terms of the loyalty, our customer satisfaction numbers in a retail center for a phone rep in the center or a face-to-face rep in the center, 92%, versus what the typical in the industry is mid-70s. So that's differentiating. So we're seeing higher retention levels, we're growing our membership, we're seeing higher and higher levels of encounters, we're seeing greater and greater numbers of health risk assessments, and this is all before the Affordable Care Act puts exchanges in place and puts more of the customer retail interactions into the market. So we're going into that time period of great, great change, having built a beautiful foundation for interacting with our members on a retail basis. We're excited about the opportunity and the challenge, and we think we've learned some terrific lessons that we'll leverage in that new environment.
there's so many things going on simultaneously, Pat, that it's easy for us to forget that we're attacking this problem at so many different levels. It's a bit like being in a jet airplane and we're swapping out the jet engines, and that seems like the biggest thing we're doing. But at the same time, we're retraining the pilots, we're picking a new destination, and by the way, everybody on the plane, we're charging you a whole different rate than when you got on to begin with. And so there are endless simultaneous things happening here, and yet you have so many different hats to wear that I think people can easily get overwhelmed and say, well, which is it? Do we eliminate waste? Do we make prevention work? Do we build retail relationships? Do we invest in new technology? It's all of the above. Are you worried that with all these changes, the fundamental, bigger, long-term changes are going to get buried over the tactical needs to fix things?
Well, that's certainly complex. And in the short term, there's a fair number of people here that are actively engaged in making sure tactically we're ready to implement a 1114. We sit here today without a lot of the guidelines and answers about what we need to do just from a technology standpoint to be ready for 1114. So that's a challenge that I won't minimize. But having said that, what we've tried to do with our organization is say this: we need to keep our eye on the ball, that for the long run, what people need are a trusted advisor who's focused on their health and well-being. If we deliver and help people be healthier, right back to our mission, if we help people and communities achieve better health, we will be successful. We don't have anything financial in our mission statement. We don't talk about the structure of the company, any of those things. We really want it to be about that mission and be passionate about that mission. So that's a test for us when we're talking about what our priorities are, how we're investing, how we're resourcing our people. Yes, we have a lot of tactical things to do, but they all have to be measured against, are we helping people and communities achieve better health in what we're doing each and every day?
So you're looking at this, I hear two completely different levels of restructuring. I hear there's a restructuring on the delivery side with all the delivery partners, but I also heard there was actually a restructuring on the consumer side, that the patient was turning into a customer, and customers know how to shop. And when customers shop, there's a psychological engagement with the shopping process and ownership of the benefits of the choice and of the disadvantages or trade-offs I made as a customer. I know when I bought a Chevy that I wasn't going to get a Mercedes, but I didn't pay for a Mercedes, so I wasn't unhappy with my Chevy. So there's this sense that you're telling me that I'm hearing is, look, we're seeing a customer revolution in healthcare. People are coming into the system now, looking to the system to say, okay, what are my options? What are my choices? I actually know more than I ever knew before because of that little internet thing and better advisors and better circle of knowledge around me. Even if I myself don't use it, the people around me know much more. And so there's been this consumerization of the process, which I'm hearing and believing you're thinking is a good thing, even though smarter customers generally can be less profitable.
I think there's a lot of evidence that show that people aren't interested in people profiting greatly off of people's health. I think it really has a different place in society. And the other part of that is, you know, we aren't running our organization like it's a charity. We're running our organization with all the discipline and rigor of a for-profit company. Ask anyone on my management team. They're as challenged to produce results, to be measured, to be stretched, to really work hard, because we are passionate about delivering for our customers. So I think we do everything that a for-profit company does, except we aren't at the whim of what's happening on Wall Street. And that's a good thing for our customers.
Well, walking the walk is the hallmark of all great organizations. Pat, I want to thank you for joining us here at TEDMed, and I look forward to meeting you and many of your team members over the years. And I want to thank you on behalf of the whole community for all the innovations and the risks you're taking. We're all going to be a better place when those things work.
Thanks, Jay. I appreciate it. Enjoyed my time with you today. And when it warms up, I'll definitely visit you in Connecticut sometime.
I don't blame you, Mr. Minnesota.
Take care.
You too.